I'm David Lombardo, and this is WCNY's The Capitol Press Room, and we're joined remotely by Dr. Chinazo Cunningham, a three-time academic All-Big Ten honoree for softball, and now the Commissioner for the State Office of Addiction Services and Supports. Welcome back to the show, Commissioner.
Thank you, David, for having me.
Our pleasure. Well, I want to start our show by talking about some provisional overdose data released this spring by the CDC, which found that predicted deaths in New York went from 4,673 in 2024 to a predicted number of 3,656 in 2025, and that was a steeper decline than I believe the rest of the country experienced. How are you digesting these preliminary estimates?
So we're obviously very pleased by that because of so much work that we've done, in terms of really focusing on harm reduction. That includes naloxone and fentanyl test strip and xylazine test strip. And that also includes really expanding treatment as well, with a lot of focus on medication treatment, because we know that medication treatment for opioid use disorder reduces the risk of death by over 50%. And so these deaths are still really fueled by fentanyl. And but what I think it also doesn't get enough attention is the role that stimulants are also playing in overdose deaths. So about half of the deaths have stimulants involved.
Well, how do you go about assessing what is leading to this decline? Because as we pointed out, New York is making more progress than the rest of the country, but the whole country's experience is improving, and not every state is doing the same thing as New York. So, how do you go about trying to figure out what works?
Yeah, I mean, we're constantly trying to figure out what works, and we're using the data that are available publicly, and then the data that we're collecting as well. And so we're constantly looking at our data, because I think the question is we should be doing more of what works and doing less of what doesn't work, right? And so we are looking at that. But I do think, we don't run randomized controlled trials in, public health most of the time, right? We don't have 5 years to wait for those, great rigorous test results. So what we use the data the best that we can to really guide us in what we're doing. So I think, and there's a lot of things happening at once. So it's hard to tease them out, right? So we're expanding naloxone distribution, for example. So we have, distributed over 540,000 naloxone kits and 27 million fentanyl and xylazine trips all at the same time. And at the same time, we're expanding medication treatment. And at the same time, we've been focusing on the work in jails and prisons. And those are people who are at the highest risk of overdosing and dying, or those who are released from carceral settings. We know that their risk is extraordinarily high. And we know that people who are unhoused and living in shelters are also at high risk. And we have another initiative focusing on, that population. So all of these things are happening simultaneously. So like teasing them out can be challenging, but I think, we are doing that. And certainly we know that there's evidence to show, medication treatment works, for example, right? And so the more that we can expand that, the more likely we are to get the kind of results that we're getting.
Well, then, when you look at the recently adopted state budget, what is in there, either from a policy perspective or a funding perspective, that you think will further the progress that is being made in recent years?
Yeah, so certainly there's a focus on young people. And we know that young people are experimenting, and, now it only takes one time to experiment and overdose and die, where 30 years ago that was way less of the case. So I think really focusing on young people. So and prevention, a youth symposium is something that we're doing. So hearing from young people about what their needs are, how we're doing, how we can do better, making sure that they know there are resources and that peers are supporting peers. We're doing right now a public awareness campaign, so that asking young people to, create their own social media messages so that we can then put that out across the state, because we know, young people listen to young people. So things like that. And then also for young people, a lot of enhancements of recovery services. And so expanding youth clubhouses. So up to 15 new clubhouses will be established across the state. Also young adult recovery residences. So up to 35 units there, that's ongoing. So those are the kinds of initiatives that are in this year's state budget. that really focus on young people. And then I think the other thing really with this budget is the issue around co-occurring mental health and substance use disorders. And we know that since COVID, more and more people have mental health symptoms and conditions. And so, and we look in our data, we can see that overlap between substance use and mental health has grown. So we work closely with the Office of Mental Health to really think about how we can continue to expand and strengthen that work there. And so some of the stuff in this year's budget include really focusing on the changes in regulations that allow programs to more easily provide co-occurring care. So that's through one license.
That made it across the finish line in the budget. I saw at one point it was kind of up in the air and maybe it was going to be handed as standalone legislation, but it sounds like you're saying that there is something concrete moving forward.
So no, you are right. It was proposed in the executive budget, and then I similarly had heard right that it was going to be a standalone. I'm actually not totally sure right now what the status of that is, but also you know, supportive housing is another area. So again, people who have co-occurring disorders, that is another area, and working with the Office of Mental Health to make sure that we've enhanced the funding there so that the rates are really more applicable to today's market rates. And then also focusing on first responders and their behavioral health needs, because we know that they're responding more and more to mental health and substance use crises out in the field and kind of how that impacts them. So those are some of the examples. Of course, we have the opioid settlement funds as well in this year's budget. And that's over $111 million. And that is also used to really support a lot of the work, the outreach, reaching people where they are, going out into communities, providing transportation, providing expanding treatment, again, harm reduction. So I think those dollars will continue to help as well in terms of continue to provide the kinds of services that are really life-saving and provide that additional support for people impacted with substance use.
And when it comes to state funding for these different programs and initiatives, as well as just your general bottom line at Oasis, how is funding keeping up with or exceeding inflation? Because it's one thing to say, hey, here's an extra couple bucks, and then you look at what your utility bill is as an organization, or what your labor costs are as an operation, and maybe that's just keeping up with status quo and not really an increase. So do you feel like there are meaningful increases that actually expand capacity as opposed to just keeping up with the Joneses, so to speak?
Yeah, so this year's budget for OASAS is up by 8%. And so that's up by $103 million. And I have to tell you, David, with all the stuff that's happening at the federal level, in fact, we were bracing for more cuts. And so, I'm pleased that we don't, we actually have an increase in our budget. And I think that certainly speaks to the governor's support in the behavioral health area and specifically for addiction. So, while we're all bracing for all of these cuts at the federal level, we're seeing an increase. I think also, this is the 5th year in a row that the governor has increased dollars for the workforce and for our providers. So this year it's a 2.7 increase. That's a targeted inflationary increase, in addition to an increase in the minimum wage. So 5 years in a row. And before that, there are spans of many, many years where there was no increase. So I think, the issue too is there's been underinvestment in the field of addiction for decades. Are we going to catch up overnight? No, right? But for the past 5 years, we've been sort of marching down and continuing to have that support that really wasn't seen prior to this governor being in her position.
And what about the logistical rollout of money and programs? Because, for example, a lot of this work is done by nonprofits. They have concerns across the human services sector about getting paid on time, having contracts with the T's crossed and the I's dotted on time. How is that something that you can, speed up or improve in collaboration with the Office of Mental Health as well as the Division of Budget?
Well, I think people need to understand that there's, state finance law that requires checks and balances of things like contracts
Sure,
of,
but there are some nonprofits that are kind of digging into their own pockets for a lot of things, and it's causing them to like lose money because they have to go out and borrow against money they're waiting for, and so they're paying interest on stuff. So there may be state laws on a lot of the books, but it also is a losing proposition for a lot of these nonprofits in some cases.
Yeah, I mean, I certainly have heard this, it's particularly around insurance companies. I mean, this is
Mm.
something we're very aware of delayed or rejected, claims. And that is something that we're working across state agencies to be able to really address better. So with our partners in the Department of Health, with Office of Mental Health, to be able to hold the insurance companies more accountable. So when we change rates, thinking of having a time frame in which they have to change those rates, and when those rates are not being followed, or when, there's all of these sort of rejections of care, making sure that we know about that and can advocate for that and work with our partners across the state. I think that's one big area. This is another thing that we've heard about, particularly with the opioid settlement funds, about dollars getting out into the communities. And, I am proud of the work that we're doing there. We've made over $450 million available, faster than any state and more than any state in the country. I do have to say that, though, these dollars are going down. The opioid settlement funds are over 18 years. More money's in the first, earlier years than in the later years. And we know that. That's just the way that the legal agreements are structured, but, with the attorney generals and the plaintiffs. But what is really important for us is that all these dollars don't go out in 1 year, that the program starts and stops in 1 year. That doesn't make sense. And so we're funding programs that last multiple years. So those are multi-year contracts. So we wouldn't expect that all the dollars would go out in 1 year, but rather the dollars go out over 3 years or 4 years or 5 years.
And after a quick break, we'll continue our conversation with Dr. Chinazo Cunningham, Commissioner for the State Office of Addiction Services and Supports. And when we get back, we'll talk about what the office is doing to address gambling addiction needs here in New York. Support for the Capitol Press Room comes from O'Donnell and Associates, a public affairs firm providing strategic guidance to businesses and nonprofits on navigating policy and regulatory issues. More information is available at o'donnellsolutions.com. I'm David Lombardo, and you're listening to WCNY's The Capitol Press Room, and we're continuing our conversation with Dr. Chinazo Cunningham, Commissioner for the State Office of Addiction Services and Supports. So in addition to the work that you do on the drug overdoses and substance abuse issues, some of the addiction services work that you do is also in the gambling side of things. And I know that's been something that has gotten more and more of your attention in recent years and was the focus of some policies and funding in the budget. So what is there to address gambling addiction, either on the preventive side of things or maybe more reactionary and trying to help people with treatment?
Yeah, so, we are very pleased with the gambling package in this year's budget, which is about $12 million. And so we know that people have more opportunity to gamble, especially with online sports betting. And we want to make sure that they are aware that resources exist. And we want to make sure that our system is well prepared to address problems if or when they occur. So some of the work in this year's budget include making sure that insurances cover gambling use disorder treatment. And so that clarification, because addiction coverage includes not just substance use disorders, but also a gambling use disorder. We also are really focused on continuing to build our system, our treatment system, to make sure that they have the capacity to address gambling use disorder. And so that's by working with our programs, giving them the training and the knowledge that they need to address gambling use disorder. And then they can apply for a gambling designation, showing that they have, the knowledge, the skills, expertise to be able to address gambling disorder. Also with the workforce, this is another area. It needs additional training, expertise, et cetera. So we have a Gambling Health Workforce Institute that we are going to be creating that will give, materials and training to the workforce to ensure that they are well prepared to address this. And then there's research. And so, unfortunately, I think people don't realize that gambling at the federal level really has no home, which means that there's no dollars to support services for gambling, and there's no dollars to support research around gambling. And so if we don't do that research ourselves, it's not going to be there. So we have funding to do research over 10 years. And our plan is to have, over that time period, multiple recurrent surveys to understand the behaviors and attitudes around problem gambling so that we understand what is happening in New York. And that, again, we can use that information to guide our services.
So a lot of that speaks to what is available or will be available to people who have a gambling problem. What about the prevention side of things? Because it doesn't seem like there was a lot to prevent some of the gambling operators from doing those more predatory actions that bring people in and help foster those gambling addictions, like constant notifications and just sort of the readiness and availability of online sports gambling in particular.
Yeah, so some of the work that we're doing is we're doing public awareness
Mm-hmm.
campaigns around gambling, and hopefully you've seen some of those. Take a pause. Actually, we just, we're running them now because of, the World Cup.
I mean, I
Um,
hear the plug for Oasis usually at the end of like a DraftKings ad, and I get to hear them say OASS or something like that.
Yes, well, it's there too, but we also have our public awareness campaign. We target at specific times, like now,
Mm-hmm.
with the World Cup or with the NFL playoffs or with March Madness and men's basketball, women's basketball for the NCAA. And that public awareness campaign talks about reducing risk. So, limit the amount of time that you're gambling, limit the amount of money that you're gambling, don't use substances like alcohol or drugs while gambling. We know that those are key ways to reduce your harm. And then there's also a tool, a self-assessment that people can take on our website so they can answer questions. And then that gives them the feedback as to whether they are low, medium, or high risk for developing problems with gambling, and then provides those resources as well. So, we continue to make sure that the public does know that there are resources and can do their own self-assessment and then can use, sort of the tips to reduce their risk.
Well, before we move on, let me reintroduce you for listeners just joining us. This is WCNY's The Capitol Press Room. I'm David Lombardo, and we're speaking with Dr. Chinazo Cunningham, Commissioner for the State Office of Addiction Services and Supports. Well, sticking with public awareness, your office this spring put out a fact sheet related to kratom, and I'm interested in this from your perspective as a doctor because there's this debate about so-called natural kratom and these more synthetic versions, and while these are both legal substances, they're not actually FDA approved to treat any medical conditions, although people are using them to address various symptoms in their lives. For starters, do you see any significant difference between a synthetic kratom product and a quote unquote natural one?
Yeah, so I have a lot to say about this. So let me just
You have
say,
3 minutes.
okay. So let me just say, natural does not necessarily mean safe.
Hmm.
You know what else is natural? The opium, poppy seed, which is what heroin comes from. The coca leaf, which is where cocaine comes from, right? Cannabis, et cetera, et cetera. So yes, kratom is, a plant, and it's from Southeast Asia. And so when we talk about kratom, it's a plant and it has many ingredients in that. And so it's really something that, we don't have a ton of data about, but the plant's been used for decades. And we know that there are symptoms that you can get that are sort of mixed symptoms. So you can get stimulant-like effects and you can get opioid-like effects. So stimulant-like effects is increase in heart rate, increase blood pressure, increase alertness, more talkative, can be euphoric. Opioid doses are a little bit the opposite, the opioid effects. And so that can be reduced alertness, reduced respiratory rate. And so you can get a mix of those symptoms. Now, the synthetic that I think you're talking about is 7-hydroxymetragynine, which is 7-OH. 7-OH is a very highly active substance in kratom. So When it's made in a lab, it's just 7-OH, so it's much more potent than kratom, which includes 7-OH, but other substances as well. So that's really the big difference, is that one is a much more sort of pure active ingredient, the 7-OH. So it's part of the kratom, the plant. So it's way more sort of dilute in kratom, the plant, but in 7-OH that's made in a lab, it's this pure substance. And so it has a much more potent effect.
And I guess how big of a concern are these things? I mean, like I pointed out, there was a fact sheet that went out from your office, but do you envision having to do a broader PR campaign, a more aggressive campaign, akin to what you might see with other drugs that might be leading to serious overdose?
Right. So I think this is a really big question. And it's not just with kratom, it's with a lot of emerging substances. We know that the drug supply is constantly changing. So we don't have very good data at all to say how common uses of kratom or of 7-OH. So we now, are changing our data collection and our routine surveys to include that information, but we don't have that information. We don't have it from the federal government. So we are behind in monitoring this. And that is what happens in general when we have all of these emerging substances that just sort of pop up and you hear about it anecdotally. And then it takes a while for us to say, hey, we really need to study this and get better data to better understand what's going on. So we are planning to do that, but it's unfortunate. So we don't have the data from the federal government that can help guide us. And we're developing right now those data collection tools to insert into our regular processes so we can better understand the use of kratom and 7-OH in New York.
Well, unfortunately, that's all the time we have for this conversation. We've been speaking with Dr. Chinazo Cunningham. She's the Commissioner for the State Office of Addiction Services and Supports. Commissioner Cunningham, thank you so much as always.
Thank you, David, for having me.
Support for the Capitol Press Room is provided by New York State United Teachers, a statewide union of nearly 700,000 professionals in education and healthcare.